Okay, so then there must be a missing piece, and then as you already conducted many of the cross-sectional data analysis, cross-sectional something, and fortunately, we could collect the 5 times of the panel data, and we started with 500 nurses, and then out of the 500 nurses, and in the first session, and we have 400, and the second session, and that is a panel. So we trace the same nurses for 5 times. So then out of the 500, we collected the 169, the same nurses, the multi-time the data set, so that we can observe that what was happened during that time. So then, there is a fragment there, and the evidence and the static design and the simplified prices. So we want to do the longitudinal study. And there is a theoretical foundation, the job demand and resource theory and the conservation of the resource theory, especially for the resource caravan. And then, we apply for the crisis theory, and there must be the crisis stages, and we will talk a little bit more. And there is a doctor's strike create a large longitudinal field of the settings. So fortunately, and fortunately, well, unfortunately, I had a situation at that time. So I was in Korea, and then originally I wanted to collect the data about study about the organic toxicity, and recently we developed the new measure of the organic toxicity, because nowadays we are talking a lot about the toxic organization make a lot of influence on the job performance and something. So that's newly emerging. And this year we published that how we can measure those kind of the organic toxicity, and that is published it. And then we wanted to collect those kind of data, the affiliated data, if the employees or the healthcare clinical nurses feel they have a more organic toxicity, toxic organization, something like it, and they may have an influence on the job performance, or the burning out, or the job resource, or the job demand, or the counter work behavior. So that was my original intention. However, suddenly that happened. So that happened, and then so the nurse, the doctor's gone, and the nurses are exposed to the big challenge, and they need to take care of all the patients by themselves. So the longitudinal design followed the same nurses across the changing crisis conditions for 5 times. And in the crisis management, theory, and then we can identify the crisis stages at the onset, escalation, peak, and recovery. So that fortunately I could collect those data in each stages, and wave 1, wave 2, wave 3, wave 4. And it takes around 17 months, 1.5 years. And nobody expected that kinds of the crisis prolonged around at the 1.5 years. Usually we have only 3 months of the strike, and then this year we have New York City, the nurses strike, probably just take only the 1.5 months. But however, this is quite an extraordinary situation, and then we could collect the data throughout that phases. And this study compares the structural, psychological, and the relational resources across the crisis phases, and this is our conceptual model. And perceived organizational health and the toxicity may influence the job performance, the care performance. And the psychological capital can be mediating these relations. And there must be the knowledge sharing behavior that can be a mediator. However, more practically speaking, and we went through the resource and the demand side. For the resource side, we went to the psychological capital and the knowledge sharing behavior. In the demand side, we tested the burnout and the counter work behavior. But however, according